Hello students. We are now going to begin with a very important chapter of general pathology, that is inflammation. Now students, at the outset what I want to tell you is that inflammation is not going to help you only in solving questions pertinent to the pathology part, but is also going to help you solve multiple questions that you will come across, especially in medicine. So you can say that this chapter is not only a foundation for this particular subject, but is also a foundation for multiple other subjects that you are going to come across in your preparation for the exam. So please try to focus on this chapter and make a strong base so that the base for the rest of the subjects is also strong. So we are going to take it in the same order and make it extremely systematic and conceptual. So the first thing that we need to know, whenever we are dealing with inflammation, there is one term that tends to go hand in hand. And what is that? That is the term itis. What do I mean by this? For example, I use the term pancreatitis. What does it have in the end? Itis. It means inflammation of the pancreas. Next, we have colitis. Again, inflammation of the colon or the colonic wall. Last example, appendicitis. Again, what is common? The term itis means inflammation of the appendix. So for the rest of all the other subjects that we have, itis, whenever you come across, will mean inflammation. Now what we need to move on to the first important topic of inflammation is how do we classify inflammation. So what is the classification? What is the classification of inflammation? Now students, what I want you to know is that inflammation is classified into two groups. There are two methods of categorizing. Most of the books and authors tend to refer to only one method. We are going to focus on both the types of inflammations and both the types of categorizations because questions on both have been asked. Now the first type of classification that we have is going to classify inflammation into two categories. And what are those two categories? Those two categories are going to be acute and chronic. So we have acute inflammation and chronic inflammation. Now students, just from the basic understanding of the language, acute means something that is quick and chronic means something that is more prolonged and is more delayed. So just if you know the meaning of these terms, you also know what is happening in inflammation. The first difference that you need to know, what is the difference in the onset? Now remember, acute inflammation will be sudden in onset. Will start off very quickly. Will start off within seconds or minutes. It is going to be sudden. That is why it has the term acute. What about chronic? Chronic, on the other hand, is going to be having a more delayed onset. It will have a more delayed onset. Next difference. After the onset, what is the duration of these two types like? So remember, acute is something that is going to begin early and is going to be short-lived. So it will begin early, it will end early. So acute inflammation will be short-lived. On the other hand, chronic inflammation, it is going to begin also slowly, it is going to have a delayed onset and it is also going to go on for a longer duration. So this is going to be long-lived. This is going to be long-lived. So we've done two very basic differences between acute and chronic inflammation. But what we are dealing with is pathology. And when we are dealing with pathology, you have to keep in mind that you will always have something known as microscopic images coming your way. So what is the microscopic examination of acute and chronic inflammation going to show you? When we talk about acute inflammation, that one particular cell that should come to your mind is always going to be a neutrophil. Remember, neutrophil is a cell of acute inflammation, always. How does a neutrophil appear? Let's make a schematic diagram. If this is a cell, neutrophil will be that cell which will have 3 to 4 lobes on an average. So you can see we have 1, 2, 3. So neutrophil will be that cell in which the nucleus is going to have 3 to 5 lobes. Neutrophil is a cell of acute inflammation. Similarly, what are the cells of chronic inflammation? So remember, for chronic inflammation, we have one very important cell, that is the lymphocyte. And we have a cell that is the monocyte. So lymphocyte and monocyte. Now students, remember again, how does a lymphocyte appear? So if this is a cell that we have in the center over here, right in the cell, in the center of this cell, you will see that there will be a single nucleus. There will be a single nucleus. So no nuclear lobes, nothing that is peculiar about this nucleus. So there is going to be a single center nucleus. That is a lymphocyte. Next, what do we need to know? Monocyte. How do we identify a monocyte? One of the very characteristic nuclei are present in these cells. So again, for example, if this is a particular cell that we have, the nucleus of a monocyte will have a characteristic kidney shape. So in a monocyte, we are going to have a kidney-shaped nucleus. A more medical terminology for kidney would be renal. So the kidney-shaped nucleus can also be known as the reniform nucleus. It can also be known as the reniform nucleus. Kidney-shaped, bean-shaped, reniform. As soon as you see this nuclear characteristic, we are talking about a monocyte. Now, one very important concept that we have over here, students, is along with monocyte, there is another cell that is known as a tissue counterpart. And what do I mean by that? When monocyte is present in the blood, as long as this cell is present in the blood, you will call it a monocyte. But as soon as this particular cell comes out in the tissue, what is the name that we are going to give? We are now going to call it a macrophage. We are going to call it a macrophage. So students, one very important concept, monocyte and macrophage, these are two same cells. Monocyte is in the blood and macrophage is in the tissue. Now, having said this, before we go on to the next type of classification and before we proceed with inflammation, the basic concept in pathology is understanding these cells. If you know these cells, if you've understood these cells, you will be able to easily understand the rest of the images. So before we proceed, let's quickly take an overview of how to identify these cells. Very important. Microscopically, how do we identify? We just made certain schematic diagrams. We just need to fit that in over here. The first cell that we have, just focus on this particular cell. This cell is, if you can correlate with the schematic diagram, how many nuclear lobes is it showing? 1, 2, and 3. What was the cell that was showing nuclear lobation? It was a neutrophil. It was a neutrophil. Neutrophil is going to show on an average 3 to 4 lobes in the nucleus. 3 to 4 lobes in the nucleus. Correct? One question that you've already done, neutrophil is a cell of which inflammation? Correct. Acute inflammation. One more question that I'm adding on for completion over here that has been asked, what is the lifespan of a neutrophil? What is the lifespan of a neutrophil? And remember, it is 6 hours. Now this question has been asked earlier, students, so you need to know this question. Neutrophil, acute inflammation, lifespan 6 hours. Now moving on to the next cell. So the next cell that I have encircled over here if you can correlate this with the schematic diagram that we had drawn. A single cell, and inside this single cell we have one round nucleus. No specific characteristic. What was this cell? Correct. This is a lymphocyte. This is a lymphocyte. Students, please recall, lymphocyte was a cell of which inflammation? Correct. It is chronic inflammation. What was the other cell of chronic inflammation? Again, you are right. The next cell of chronic inflammation is the cell that I have encircled over here. And this cell is a monocyte. This is a monocyte. Now students, remember and recall, monocyte was in the blood. Tissue counterpart is macrophage. And what is the characteristic shape of the nucleus that we have over here? It is a reniform. It is a reniform or a kidney-shaped nucleus. It is a reniform or a kidney-shaped nucleus. Very important point. Now, since we are dealing with cells over here, I want to finish off the discussion of other cells as well. What is the next cell that we have focused over here? One very important point over here that you can see, students, is where is the nucleus present in this cell? Is it in the center or is it eccentric? So remember and see carefully, the nucleus is eccentric. We have an eccentric nucleus. At one end, at the periphery, away from the center, eccentric. First, very important point of this cell that I'll be talking about. Next, students, I want you to focus. If you can appreciate just around this particular nucleus, do you see one empty space? Something that is very light staining, something that appears clear. This, students, is the perinuclear because it is present around the nucleus. So it is perinuclear, and because it is an empty space, we are calling it halo. So this is a perinuclear halo. So two features you've done of this cell, eccentric nucleus and a perinuclear halo. What is this cell, students? This particular cell is a plasma cell. This is a plasma cell. So two features which will help you identify plasma cells now onwards would be the eccentric nucleus and the perinuclear halo. There are two more questions that are asked on plasma cells, particularly on the normal plasma cell over here. And what are those two questions? When you are talking about the nucleus, I said it is at one end, it is eccentric. They also tend to ask you the type of the chromatin. So the question that comes is that these nuclei have a cartwheel, they have a cartwheel or a clock face chromatin. They have a cartwheel or a clock face chromatin. Very important question, students. This has been asked in the previous year exams. Nucleus at the periphery, eccentric with a cartwheel chromatin. The next question that is asked. Around the nucleus there is one empty space, halo. Why is it that this particular cell has this halo and no other cell till now had this halo? That is because there is an increased amount of the Golgi apparatus that is present in the plasma cell. So remember, if you are asked that what is the halo in a plasma cell due to, it is because of an increased amount of Golgi apparatus. Increased amount of Golgi apparatus. Very important point, students, that you need to know. So four things about a plasma cell. Number one, nucleus is eccentric. Number two, the chromatin is cartwheel. Number three, the area around the nucleus is clear, calling it a perinuclear halo. Number four, that halo is because of Golgi apparatus being more in a plasma cell. Very important question, plasma cells. The last question that we need to do over here, or the last cell that we need to do over here, is this particular cell that we have. Now students, one thing that should immediately come to your mind over here, that you should focus on. something in the color of this cell is different from the colors of the rest of the cells that we did? Yes, as you can see, the cytoplasm has pink-orange granules. There are pink-orange granules present in the cytoplasm. No other cell till now had these pink-orange granules, right? Different. One more thing is different. Focus on the nucleus. Can you appreciate that the shape of the nucleus is like this? Or I can say it is a spectacle shaped nucleus. It is a spectacle shaped nucleus. So two features, spectacle shaped nucleus, pink-orange granules. Which cell are we dealing with, students? We are dealing with an eosinophil. We are dealing with an eosinophil. Very important cell that we have, which we will be discussing in great detail when we go to chapters on allergies and hypersensitivity type 1. Eosinophil will have a major role to play over there. But at the outset, one question I want you to finish off over here. What are the conditions in which an eosinophil will increase? So please remember there are two very important conditions, and these include allergic conditions. So allergies, example type 1 hypersensitivity. And second, which infections? These include the parasitic infections. These include the parasitic infections, right? So eosinophils, orange granules, spectacle nucleus, allergies and parasitic infections. So these are the main cells with which we will be dealing in the rest of the subject. We've made a base of this over here. As and when each cell comes up, we are going to revise these images and make it strong for our exam. Now coming back, students, we were discussing that there are two types of inflammations, acute and chronic. What were the cells of acute inflammation? Neutrophil. But whenever you come across any general rule, remember there will always be an exception. So if I say that all acute inflammatory conditions will show neutrophils, is there any exception? Yes. Typhoid is an acute condition. It is an acute infection. But typhoid is not going to show an increase in neutrophils. Instead, students always remember typhoid shows neutropenia. Penia means decrease. So typhoid shows a decrease in the neutrophil count, not neutrophilia, not an increase. So this is an exception. Now if neutrophil count is going down, then instead in this infection, which cell is going to rise? So remember, in typhoid we will have relative lymphocytosis. In typhoid we will have relative lymphocytosis. So very important feature. All acute inflammatory conditions will show neutrophils. But typhoid is that acute inflammatory condition which will not show neutrophils. It will show neutropenia with relative lymphocytosis. Similarly, I told you cells of chronic inflammation are correct, lymphocyte and monocyte. But is there any exception to this? Yes, there is an exception. There is something known as chronic pseudomonas. So whenever there is chronic pseudomonas, from the term chronic, what should come to your mind is that we are going to have lymphocytes, monocytes. But it is an exception. Instead, pseudomonas, when staying for a longer duration also, tends not to show cells of chronic inflammation, but cell of acute inflammation. That is, it will show neutrophilia. So you can say that there is a cross over here. All acute inflammations, neutrophil, except typhoid, which does not show neutrophils, instead shows a cell of chronic inflammation, that is relative lymphocytosis. Other way round, all chronic inflammations will show lymphocytes and monocytes. But we have an exception. Chronic pseudomonas will not show these cells. Instead, it will show a cell of acute inflammation, that is neutrophils. So students, this was the first way of categorizing inflammation. That is, we can categorize it under acute and chronic. Now, what is the second way of categorizing inflammation? That is on the basis of the type of the fluid that is secreted. Every inflammation will secrete a certain fluid. The nature of that fluid will be our basis for the next classification. Now, what is the fluid? The one that we have in this category is serous inflammation. Will be serous inflammation. Now, students, for the rest of every subject that you will deal with, remember, whenever we come across the term serous, it means clear and watery. It will always mean clear and watery. Wherever you come across this term, anywhere now onwards, clear, watery fluid, it will be a serous fluid. Now, this type of inflammation is usually seen in effusions. That is in the body cavities. In the body cavities. What do we mean by this? For example, the pleural cavity, pericardial cavity, peritoneal cavity. Everyone knows that these are body cavities. So the lining of the body cavities in inflammation releases this clear watery fluid that is an effusion. And what type of inflammation would it be? We will call it a serous inflammation. Next, if the nature of the fluid is now different, we are going to call it fibrinous inflammation. We are going to call it fibrinous inflammation. Again, another concept that we have for the rest of the subject, wherever you come across this term fibrinous or you come across this term fibrin, the gross appearance of such a fluid will always have certain threads. It will be thread-like. If I try to pull or if I try to pick up such a fluid, it will have a very stringy or a thready consistency. So this is going to be thread-like. So fibrin will be thread-like, such a fluid will be thread-like. Now, what is the example that you need to know over here? Students, one very important topic of cardiovascular pathology is rheumatic heart disease. And in RHD or rheumatic heart disease, the pericarditis that we see is the fibrinous pericarditis. So, focus on the term pericarditis means itis, inflammation. Pericarditis, everyone knows we have the pericardium, the pericardial cavity. In that, there is going to be inflammation. So, some fluid will be released. What fluid? What is the nature of that fluid? It will be fibrinous. So, fibrinous inflammation or fibrinous pericarditis. Moving on to the third example. Now, the third example is a very common example that everyone has seen and as well as experienced, and that is purulent inflammation. What do you mean by this term purulent? Purulent is nothing but pus. So this now simplifies it. Now everyone can visualize that pus means purulent inflammation, and everyone knows we do not need to focus too much on the examples, but remember that pus will be seen in conditions like abscess. Simple to remember, purulent means pus. The fourth and the last one, students, that we have is something known as, the one with a slightly more fancy name is catarrhal inflammation. Now, let's simplify this. Catarrhal, if I tell you the meaning of this term, you'll automatically know which example I'm talking about. So, catarrhal basically means mucus plus water. So, yes, you can easily now know in common cold. In common cold, what is the fluid or what is the nature of the secretion? It is mucus and water. So, the best example that we can give over here is common cold. So, students, on the basis of the fluid that is released, we have 4 categories. Number 1 was serous, watery, body cavities. Number 2 we have is fibrinous, fibrin, thread-like, rheumatic heart disease. Number 3 is purulent, means pus. Number 4 is catarrhal, means water mucus, means common cold. Out of these four, if you are put up a question that which is the most important and the most common, so remember this fourth category that we just discussed. This particular category is the most common and the most important form of inflammation that we have. Most common, most important. So students, with this we finished two very important classifications of inflammation. One on the basis of timing, that is acute and chronic. Other on the basis of the fluid that is released, of which the most important and the most common one was catarrhal inflammation. With this, we are now going to move on to another very important concept-based topic of inflammation, something that is very basic, but in this thing that we have to cover a lot of topics, we tend to miss out on this basic, but it is very important. And those happen to be the cardinal signs of inflammation. Cardinal signs of inflammation. So first we are going to make a list and then we'll do the meaning of each one of those. The cardinal signs include number 1, that is rubor. Number 2, Calor. Number 3, dolor. Number 4 is tumor. And number 5 is loss of function. So first let's do the meaning of each one of these, then we can come back to a more important question on this particular topic. Rubor. Now R for rubor and R then stands for redness. R then stands for redness. R for rubor, R for redness. The next that we have is calor. Now go back to your physics and chemistry days. Caloric or calor meant an increase in temperature. So calor would now mean an increase in temperature. Increase in temperature. So coming to the third one, what is dolor? Dolor then stands for pain. Dolor then stands for pain. D, P, D and P, we will remember it by the mnemonic display picture, DP. So D for dolor and P for pain. Next we have tumor. Now students, we are talking about inflammation. We are not talking about some cancer, some malignancy. What is tumor doing over here? Tumor, please do not confuse it with some cancer. Tumor in this cardinal sign only means some swelling. Right? So now you've got, for example, everyone has seen and has experienced an abscess. What happens to the color of the overlying skin when someone has an abscess? It becomes reddened. It is rubor. What happens to the local temperature when you compare it with the normal temperature? The temperature of that abscess is raised. What cardinal sign would it be? Calor. Over a period of time, the patient also complains of pain, that is dolor. Abscess is a swelling, visible swelling, so we are going to call that a tumor. And if that particular lesion, now that abscess that for example that we have taken, increases in size and is going to hinder the daily activity of a person, that is now known as loss of function. So that becomes the fifth cardinal sign, that is loss of function. So students, the meaning of these 5 cardinal signs was for our understanding and was for our concept. What we need to do is that we need to focus on the historical aspect. Let's go back in time. We need to know who gave us these cardinal signs. So how are we going to divide them? Remember the first 4 cardinal signs. The first 4 cardinal signs that we have, these were given by a scientist, Celsus. Celsus gave us the first 4 cardinal signs. What about the 5th cardinal sign, that is loss of function? This was given by a very important scientist, students, that is Sir Rudolf Virchow. Sir Rudolf Virchow gave us the 5th cardinal sign. Now students, since we are talking about such a famous scientist who has contributed immensely to the subject, we must note down what are his other contributions so that whatever collateral questions we have regarding the scientist, we should finish off over here. One contribution you've done, Sir Rudolf Virchow gave us the fifth cardinal sign, that is loss of function. What else has he contributed to? There is something known as the Virchow cell. Correct, students. I want you to recall a link not only with infectious diseases but also with microbiology. Virchow cell is going to be seen in which disease? Correct, it is seen in Hansen's disease, or you can say simpler terms, leprosy. Virchow cell is seen in leprosy. What are his other contributions? He also gave us something known as the Virchow triad. Virchow triad. What about the Virchow triad? First of all, for what disease do we consider this triad? This triad is considered for thrombosis. This triad, the Virchow's triad, is for thrombosis. And if you're talking about a triad, means we are going to deal with three things. And what are those three things that you need to know? So the three things that we have in the Virchow's triad include, number one, that is stasis. What is stasis? Blood flow slowing down. Other way around, blood flow increasing. What would you call that? Or blood flow becoming more turbulent. So I will make it as turbulence. So you can say overall the first aspect of this triad will be a change in the blood flow. Either the blood flow is going to become slow, stasis, or very quick, that is turbulent. The next part of this particular triad is endothelial cell damage. Endothelial cell damage. What are endothelial cells? Now, if this is, for example, a blood vessel, the cells that are lining the blood vessels, these are the endothelial cells. So, endothelial cells are the cells lining a blood vessel. When they undergo a damage, that becomes the second part of this triad. And the last part of this triad, students, is hypercoagulability. So there are certain states in which the body's coagulation system or the clotting system tends to get activated more. So we are going to call it hypercoagulability. So these three things, change in blood flow, endothelial cell damage, and hypercoagulability are together going to formulate a triad, that is the Virchow's triad. So Virchow gave us first loss of function, second Virchow's cell for Hansen's disease, third Virchow's triad for thrombosis. What else? These already had the name Virchow, so it was easy to remember. Now we need to know some other terms. Remember, Rudolf Virchow is known as the father of modern pathology. Very important, students. A question that is a repeat not once but multiple times. Father of modern pathology is Rudolf Virchow. And lastly, he gave us the term cellular pathology. So he coined the term cellular pathology. So we've done 5 contributions, 5 very important contributions of this particular scientist. Before we proceed, we are dealing with scientists. We've done 2 scientists over here. The first 4 cardinal signs was given by, you're right, that is Celsus. The 5th one and all these things that we've discussed were given by the father of modern pathology, that is Rudolf Virchow. Are there any other scientists that you need to know in this particular chapter? So let's finish off all our collateral questions also. Remember, when we talk about today, that is phagocytosis. When we talk about phagocytosis was given by the scientist Elie Metchnikoff. Elie Metchnikoff. So as big as the name phagocytosis, as big is the name of the scientist, that is Metchnikoff. Again, a straightforward one-liner, multiple time repeat question. The next one, the next thing that we have, the last scientist that we need to know, There is one mediator that we will be reading a lot today, that is histamine. One of the very important mediators of inflammation, that is histamine. Who gave us the term histamine, or who discovered histamine? That was Sir Thomas Lewis. That was Sir Thomas Lewis. So students, we've done 4 scientists. First 4 cardinal signs by Celsus. 5th cardinal sign and father of modern pathology, Virchow. Phagocytosis by Mechnikov, as long the name phagocytosis as is the name Mechnikov. And lastly, histamine has been given by Sir Thomas Lewis. So these were all the basic concepts of inflammation that you need to know before we move on to the next particular topic.